So again, before I explain to you what a holistic physician is, and that's what I am actually, let's look at the way traditional medicine is being practiced. So if you have a symptom, say depression, or you have GI symptoms, you have irritable bowel, or maybe you have hypertension, you're going to go out and you're going to seek the physician that you feel can address that particular problem best. So one of the things that you'll see is that if you go to a doctor that deals with depression, you're probably going to get some medication. And what they're going to do is maybe they'll do a scan of your brain, maybe they'll do some EEGs. It just depends on your symptoms and what they're going to do and what kind of tests they're going to run. But it's going to be primarily focused just on the brain. Now, if you see a GI doctor for irritable bowel syndrome, what they're going to do is they're going to do similar tests. They're going to do whatever medical tests, blood tests, imaging tests, whatever they think, maybe even some scoping, to see what's going on with the GI system. Well, that's all great if those problems arise only from that particular area. So when you're seeking out a holistic physician, he'll look at it and say, well, medicine today uses one cause, one cure. So if we have depression, the cause is depression, the cure is Prozac. If you have irritable bowel, well, you have irritable bowel, we're going to give you a medication for that. If you have hypertension, your blood pressure is going up, you seek the cardiologist, he's going to give you medication to reduce that hypertension. What they're not going to do is look at the whole system. So that means everything. So when a patient comes into me and you have depression, we're not just going to look at your brain or your brain scans. I mean, we're going to rule out tumors and things like that, whatever we have to do, or you've probably already had those things done. What we're going to do is we're going to look at other symptoms in your body. So maybe you have some GI disturbances, maybe you have some fatigue, maybe you're having hormonal problems, thyroid issues, weight gain, or there's other subtleties that you just don't realize that are going on. And the way we actually get to that is really unique. We have an online questionnaire that asks you about 300 questions about your overall health. So we're going to go through 15 systems of your body, and what we're going to do is start to look at those systems and see where the cause of this depression is really coming. So this is a really new idea for the public, but it's not new for doctors that practice functional medicine like myself. So we're under the impression that, okay, one cause, one cure. I coach hockey and I treat athletes, so you got a kid that goes crashing the boards, he breaks his wrist, the cause is he hit the boards, he broke his wrist, the cure is the cast. Very simple. But in most people's cases, what you're seeing is these other underlying dysfunctions that are very, very subtle, that are representing dysfunctions in other systems of the body. And one of the things that you may not even realize is that depression can have many causes. Anything from thyroid problems to adrenal problems to gut problems. Meaning, what I mean by gut problems, what do you mean by that? Well, inflammation of the intestinal system. One thing may be gluten. Another thing may be food allergies. You can actually have a bacteria in your intestinal system creating other deficiencies on other systems like the liver that even causes schizophrenia. So when you're a holistic doctor, what you're doing is you're looking at many, many causes to cure that patient or to improve that patient. So it's not one cure, one cause. It's many causes and addressing those causes and underlying dysfunctions to cause the improvement in the symptom to go away. So depression is just a symptom of other problems and other health problems in the body. So the next time you seek out a physician, I'm not saying it's not good to look at a particular area of the body, but what I am saying is that if you're not getting help, which probably you likely aren't getting help, or at least you're required to take medication on an ongoing basis, seek out a doctor that practices holistic medicine and be really frank and be really clear. Ask him, are there many causes to the same symptom? If you have 10 patients that come in your office with depression, are the treatments the same? And if he says, yes, they are, I would question his approach, and I definitely look for a different doctor. Again, thanks for tuning in. I hope this information was helpful. If there's any way that our clinic can help you or lead you to a physician in your area, please give us a call. Again, thanks for tuning in.